On this episode of the Quad Matrix Q&A, we're going to answer a question that we commonly get, which is what's the easiest way to remove my matrix bands after I complete a beautiful class 2 restoration with the new Quad Matrix system? And one thing that I've realized is that doctors they love it when the matrix bands just pop out after a restoration's done. But if they're just sliding out of place without much resistance, then you're probably getting light contacts, because if we have a properly contoured restoration with a tight proximal contact, then this matrix band, that means that matrix band's like pinched in between the two teeth. Okay, so when we get to this point, if your matrix band is giving you resistance, then pat yourself on the back because you've done a fabulous job and you're going to get an amazing contact. But one thing you'll see in the kit is that Garrison's come up with a super cool pair of matrix forceps that are designed kind of on a 90-degree angle. They're kind of like a hemostat, but on a 90. So you can just reach from the front of the mouth and just reach over in the back and just pluck these matrix bands out with ease. So it's going to give you like hemostat pressure without the awkward shape of a hemostat, and it's going to be much better at getting these out than cotton pliers, which sometimes if our cotton pliers get a little bent or they get a little used, they don't grip very well, and then you're trying to grab this super thin piece of metal, and you're trying to get it out of a tight space, and it can be difficult. And so all I do is I usually go down the one of the walls of the exposed matrix band, usually the buckle or powder, whatever I can see the easiest, and I just clamp down, and then I'll just kind of like roll that matrix band right out of position again once that restoration is done. But these things are pretty nifty, and they're in your kit, so you can give them a test.